Well, ladies and gentlemen, President Trump's admin today sent hospitals and clinics to the Department of Justice and the Health and Human Services Office of Inspector General after RFK Jr. and Vance referred providers named in a operation called Wolves in White Coats. Yes, the report that they created found that $61 million trail with about 50 million billed as unspecified endocrine disorders and nearly 11 million as precocious puberty in patients ages 13 through 17. Yeah. So what does that mean? Well, it means that this is a huge case, a case that shows bad actors use billing loopholes to make insurers pay for gender related treatment on minors. And none of this says that they had gender dysphoria, which would probably be the correct medical terminology. Okay. And that referral changes the stakes. Okay. Investigators now are going to have to compare the claim to these charts, the treatment, and the payer rules. And that's how this political dispute becomes a testable billing question. Now, the headlines that we're hearing is that this is a fight over transgenderism and gender-related procedures. But the real story is that RFK Jr. and JD Vance, under the leadership of President Trump, have connected a billing fight about codes, insurance claims, and a federal enforcement process to protecting children. Now, if the care that was given was accurately coded and documented, well, providers will be able to show that. If the codes were used to make a different kind of care payable, investigators will have a direct trail to follow. Now, the administration has moved this out of the realm of slogans and into records. So if we start with the first receipt, HHS says that more than 225 hospitals and health systems established pediatric gender programs nationwide. Its analysis examines insurance claims from 2015 through 2025 and identifies about 50 million in claims for puberty blockers billed with code E34.9. E34.9 is the diagnosis code for endocrine disorder unspecified. The report says the code was used in claims connected to puberty blockers and argues that a general endocrine code can conceal the underlying purpose of the treatment and ultimately hide it from the payer reviewing the claim. So the report also identifies nearly 11 million in claims for patients 13 through 17 billed with code E30.1. That's the code for precocious puberty. Now, here's the alleged mismatch. If those drugs were prescribed to treat gender dysphoria, the claim should have identified the condition that was actually being treated. Gender dysphoria is presented in the F64 code. Okay. And HHS's theory is that E34.9 or E30 made the claim look like an endocrine or early puberty treatment instead. Now, if you put these figures together, the administration is looking at about 61 million in coding trail. Now, that number matters, okay? It claims a pattern attached to name diagnosis codes, dates, patient age ranges, providers, and ultimately payers. And those are the handles that investigators are going to use to move this from an allegation into a record. Now, the key question here is simple. Did the diagnosis codes accurately describe the patient's conditions and the treatment that was actually delivered? Because the diagnosis code tells an insurer why the care was provided. A procedure or drug code tells the insurer what was provided. But when those codes and those pieces don't line up, the government has a legitimate reason to ask the question why. And that's the mechanism underneath this headline. The administration is not merely arguing that the procedure should stop. HHS has put out the coding and billing question in front of the DOJ and HHS. Okay, their OIG. The report's language makes the next step pretty clear, though. The claims analysis is a signal for independent investigators to verify it against the underlying billing records. Okay, it covers care that's billed through insurance, but not every transaction in the country. Now, these ages, I believe, in the report are estimated based on the patient's birth year. And look, a claims database can't show what a doctor knew when a code was selected, but that limitation does not erase the referral. It just explains it. The government doesn't need a claims spreadsheet to be the final verdict before it opens the file. It just needs enough specific information to identify what records should be reviewed. So providers now have a straightforward response available to them. Produce the charts, produce the coding, show the guidance, make sure it fits the payer rule, and the explanation for the diagnosis that was selected. And if the records support the claims, well, that will come out in the laundry. If the records show that a code was used to obtain coverage for something it shouldn't, or something it didn't subscribe or describe, that'll come out too. The important part of this is that accountability is running in both directions. HHS has made a public allegation, and the DOJ and HHS OIG are going to establish what happened provider by provider. The administration's credibility now is going to be measured by whether it follows the evidence where it leads. And I think they will. But I want you to look at the second receipt. On August 11th, HHS announced a final rule ending federal Medicaid and CHIP funding for the procedures that we're talking about here. There's a tapering period of up to 6 months for children already receiving hormone therapy. And that rule is scheduled to take effect in October 13th to be exact. And that funding rule and the DOJ referral, while they're different actions, they show some similarities or correlation. Okay, the rule changes what federal programs will pay for, but the referral asks whether providers represented the care that's already in the system accurately, especially considering the substantial cost of the submitted claims. And together, they show a government using both policy authority and enforcement authority. So the message from the Trump administration is not complicated. Federal programs will not keep financing gender affirming or gender care for minors when it's not properly documented. Okay, the administration has rejected this, and federal investigators are going to examine whether the claims that were already used to obtain payment were accurate. Like, that's the big difference here between announcing something like a position and actually building an accountability system. How many times have we said, I don't care if you want to be transgender. I just don't want to pay for it. That's what this is about. Okay. And there's a third receipt. It's the enforcement lane. Okay, it's already forming around these questions. The DOJ announced a subpoena enforcement action involving Rhode Island's hospital on May 1st. On the 15th of May, the DOJ announced a Texas Children's Hospital resolution involving $10 million in allegations of false billing. On June 5th, the DOJ announced that there's a Cleveland Clinic resolution involving $308,000 in false billing. Cleveland Clinic has denied the allegations, but they have to be investigated. And those prior releases are, while they're not proof that every provider in the new HHS report committed fraud, they show that the DOJ is already using subpoenas, resolutions, and billing allegations as enforcement mechanisms in this area. So the referral today puts a larger claims analysis into this lane. And this is where the political meaning becomes clear. The administration promised to examine fraud, waste, and abuse. But simultaneously, they committed to parents across America that they were going to protect our children. And HHS didn't leave this as a report on a shelf. J.D. Vance and RFK Jr. attached that report to a referral and sent the identified providers to the agencies that are going to demand records, test the coding, and bring a case if the evidence supports it. So this argument is no longer about whether a hospital should offer a particular procedure. It's about whether a hospital can describe that care one way in public and another way on the claim submitted to an insurer in order to hide it or make it claimable or paid for. Now, for us taxpayers, the question that we have for HHS and RFK Jr. is how much of this 61 million was paid for by Medicaid, CHIP, or any other public program? Now, the report gives us an insurance claims tool, but it doesn't give us a payer breakdown. Some of it may be taxpayer money, but nobody can honestly call all 61 million taxpayer dollars yet because the HHS has to publish that payer mix. Now, parents, we also deserve a clear record of what was done and why. Okay, providers who believe their billing was proper should be able to show it. Providers who used vague codes to change coverage should face some pretty harsh scrutiny. Again, I live in Ohio, and I'm sure myself or my relatives wouldn't want to send our kids to somewhere in the Cleveland Clinic where maybe there's a provider who has performed such schemes on the federal government or the insurance companies, because it's just against our ethics and principles, right? So look, folks, if you want the receipts when the DOJ and HHS OIG show what the records establish, subscribe with this channel. Stick with me, okay? Nobody's showing you what I'm showing you, and I promise you that. So the administration now has to finish what it started, and they're going to. This referral creates responsibility. The DOJ and HHS OIG are going to identify the providers, obtain the underlying records, compare the diagnostic codes to the treatment, and determine whether the claims were accurate. There are three possible outcomes. Investigators may find that the claims were supported, which I think generally we hope they were or are. They can find that particular providers or practices were warranted. Or they can narrow the issue to certain codes, certain dates or pairs or procedures, instead of treating this all like, one entire big case. But all three outcomes are better than letting a $61 million signal disappear into the political ether. Okay, if the claims were legitimate, the record should clear the providers. If the claims were not legitimate, the record should identify who was responsible and what was paid for. And the next checkpoint now is not another speech, and I'm sure that we won't get one. It's going to be the subpoena, then an investigative filing, a provider response, a settlement, or maybe a charge, or a finding tied to the records. The October 13th Medicaid and CHIP effective date, that's the next public policy milestone. This new DOJ and OIG referral doesn't have one yet, but the investigation document is going to be the next thing that matters. So this is why the $61 million trail is the real story here. It's given the Trump administration a specific path from policy concern to federal review. It named the codes, the claims, and the institutions that are going to have to answer. It's turned a national dispute into an evidence test. The public record today is a referral, not a condition or a conviction, And that's the legal status of the case. But it's not a reason for anyone to stop asking questions. The administration has put the evidence in the hands of their investigators, and those investigators are going to prove what the codes were used for, what they described, what the providers delivered, and whether we, the taxpayers and insurances, paid for an accurate claim.